Hello, everyone. Thank you all for joining us today. I am really excited to go over a really important topic for us professionals over clinical burnout. Today, we are touching beyond self-care and towards sustainable practice, which we want you all to apply. And I'm super excited for Mariah to give us this information. And before we get into it, let me go ahead and give you all some information on today's course. So, of course, you will be able to earn a 1 CE credit for your license to renew with Agents of Change. And I, Bonnie, am giving your presentation today, asking some of the questions. I do have a background in social work. I received my bachelor's and master's degree at the University of Texas, Rio Grande Valley. I've got various backgrounds with foster youth, as well as working with adults and children of other populations all around the United States. And of course, with this, sometimes burnout can happen, right? Need to make sure that we take care of ourselves. And I'm hoping that there's some really great things that we can learn from Mariah, not only her experience, but also her practice, to apply for ourselves. So, a little bit about Mariah. Mariah does have her licensed clinical social work license. She also practices somatic psychotherapy, and she's the founder of Relv Wellness Counseling, which is a virtual private practice. In this virtual private practice, she is serving adolescents as well as adults, mainly within the Dallas-Fort Worth area, so over here in Texas. She does have more than 7 years of experience, and this clinical background includes general special education within social work in school settings as well, special education. She also supports BIPOC women and adolescents navigating anxiety, trauma, ADHD, stress, and major life transitions, which I'm really excited to get into that as well and how that's connected to burnout. Okay, yeah. So really, really great experience here with integrating that into your practice. So I'm hoping we'll be able to get into that a little bit here, depending on like how we're going about this conversation with self-care and burnout, because as we mentioned, we're wanting to take it a step further and how we practice preventing this burnout for us. So as we're getting started here, I would like for you to kind of just tell us about burnout, introducing yourself, and share what is it that drew you to social work?
Okay, so my name is Mariah Peloso. As Bonnie mentioned, I'm a licensed clinical social worker. I'm a registered yoga teacher and sound healing practitioner, and I'm licensed in both Illinois and Texas. I have 7 years of experience between general and special education school social work. I also own a holistic mental health private practice named Releve Wellness and Counseling, where I work with primarily BIPOC adolescents and women that are experiencing anxiety, trauma, ADHD, and major life transitions. So I work with some individuals. I do some group work. I'm really passionate about clinician burnout. So I maybe on a bi-quarterly basis, that's twice a year, right? Yeah, bi-quarterly. I typically run somatic support groups for BIPOC therapists. I also do some clinical supervision, and I've recently gotten into the corporate wellness space. So I do some wellness programming with corporations and organizations. And as far as what got me into social work, there's so many ways that got me there. I think it was who I was. I just didn't realize I was doing it for free my whole life. But I had a family member who was in foster care that lived with us as when we were teenagers. He was real tight with her caseworker and would always talk to her. And I was always just curious as to what happened and why she changed so much over the time between when she had been integrated into our family growing up to when there was some space in between her coming to stay with us. And that's when I found out that the caseworker was a social worker and she's telling me everything she did. And I'm like, man, I've been doing this for free, just getting to know people and helping them. Like, that's a job. And I was 16 at the time. But from there, blessed to have been certain about what I wanted to do. And then I went to school, of course. And once I got into my program, got to learn that social work was so much more than I could have ever imagined. I honestly didn't even realize I could be a therapist till probably like midway through grad school. And from there, I started in schools. So I think a lot of my motivation or inspiration to starting schools was my sister's an educator. So, someone I've always looked up to. I've seen her get her summers off, which were really nice too. And I love
Yeah.
kids. And so that I will always be a school social worker at heart. But I noticed that as time was going on, I was starting to get the same excitement about the things I was building in my practice. And there was just so many things that I wanted to build on, and there just wasn't space anymore. So it was time to move on. And so this is where I am now. So I do my clinical work in my practice. And like I said, I teach yoga. I'm also certified in trauma conscious yoga method, which is really like manifest or parts work plus movement. So I integrate that into therapy. And I'm also certified in brain spotting. So, EMDR's cousin, stepsister, whatever you want to call it. So rather than about the eye movement, we're looking for the gaze. And so I integrate all of those things together, as well as some expressive arts. I have a background in dance. That's something that I've done my whole life. And so I like to be able to bring all those things together, hence the title Releve for my dancers out there. If you know, you know, it means to rise in French. It's a ballet term, but yeah, that's a little bit about me and what got me here. I started my yoga journey about 7 years ago. And as I was going through that, I noticed that something else was happening bigger than just on a bodily level. It was changing something up here. And I was just curious to understand what was happening. And then as I began to study yoga outside of the movement, I realized, the practice that came with it before was asana or movement in Sanskrit. And realized that I could integrate it with clinical work and how closely aligned it was. And that's how I've gotten here. And
That's
it's been
amazing.
yeah.
Thank you for sharing that with us. I was actually looking into your title of your practice, and that association with rise and releve meaning rise in ballet. And I was like, oh, how neat. And I wanted to ask about it, but I'm so glad that you shared on it because I was really intrigued by that as well.
Yeah, and honestly, there was no rhyme or reason when I did it. I think I was just sitting when they was like, that sounds cute. And it happens to me, right? Like I probably wrapped that up somewhere in like a mission statement or something. And it just flowed. Like it was one of those things that just came to me naturally. And I think that's why when I started my practice, it all just happened very naturally. I didn't feel like I was sitting with the name or going back and forth. It was just like I like the way that sounds. And it actually really ended up resonating. So
Yeah, definitely. Those aha moments that just click, right?
yeah.
Awesome. Thank you. I'm going to go ahead and share why our topic is so important today as well. Sharing with you all that are joining us that clinician burnout is more than just feeling tired, and all of the overworking that we might be wanting to do of helping, just as you mentioned, getting into social work way before. I definitely agree with that. Always just helping out people and then it just clicking with this being a career path to follow. But it's more than just that. It's something that can affect clinical judgment, emotional presence, boundaries, documentation, as well as the quality of care that clients receive. We want to make sure that we are taking care of ourselves so that we can show up for our clients. And that's why this is so important to have you all learn about these skills and learn more about this topic today. So, this conversation is really going to help you all recognize burnout earlier, understand how stress impacts the nervous system, as well as move beyond some of the generic self-care that we might be very well aware of. And so move towards more practical things, trauma conscious as well, some of the experience that you have, and notice some workplace solutions as well. So we're super excited to give you all some of these insights as to why this is really important for you to apply as well. So with that being said, of course, clinical burnout is often reduced to feeling tired or overworked. So, how do you define what is burnout and what do clinicians commonly misunderstand about this?
Mm. What is burnout? What do clinicians commonly misunderstand? I think whether it's in the field of social work or outside, I think whenever you are burnt out, it can be very challenging, or it's not even something that you're thinking to identify in the first place because you're just going through the motions. And so I know it was identified earlier that I am a somatic psychotherapist. And so in Greek, soma means body, right? And so when we think about somatic, it's about being in body, learning how to listen to your body, and pausing to see what your body is trying to share with you. And, I can't address these topics without addressing, the systemic pieces at hand that are impacting the systems that we all are working and are a part of. And so, in a capitalistic society, a lot of things promote, or a lot of the ways that we are taught or, conditioned to work or to be promotes disembodiment. And so if you're constantly going, so we're constantly working, you got your schedules outside of work, if you've got kids, family you're taking care of, other hobbies, self-care, your health issues, whatever it might be. You have all these things that are constantly going and ding, ding, dinging. Don't let me even mention these things, right? But when we're constantly go, go, going, it takes away from that opportunity for us to pause and to notice how we're really feeling and to access and, process what's happening within us. And whenever that happens, that's how some of that burnout can start to kick in. And so it's, none of this started when we were clinicians. It started way before then. And then you also want to maybe even add in like the dynamics of, growing up in Black and brown communities or marginalized communities or, you know, there's so many different factors that, what am I looking for? So many different factors that contribute to how we get to burnout, especially if it was something that you were taught to just go, go, go. And you have seen that, with the adults that you grew up around, right? So I know even especially, so I'm a millennial. So the generation before us, my parents, they were taught to, never take a day off. They stay at the same job for 30, 40 years until they retire, right? And a lot of them have health issues now, especially like I'm going to compare it to Black women because that's what I grew up seeing. And so a lot of Black women have autoimmune diseases that end up being suppressed emotions, specifically anger, that they didn't necessarily get the space to process and be with. And, if we're not taking those breaks, we're not getting the opportunities, and not even just the opportunities, but not being taught or even having the examples of what it means to pause and to listen to what's going on. But then on the other side of that, it's also like there's privilege in being able to pause and slow down, right? Because sometimes people don't have the option to take off or whatever you might be in. But as it relates, let me fast forward back to being a clinician. I just wanted to bring all that up because these are all things that we've been conditioned to believe and think, and this is how we've gotten to where we are, right? You also have to think about some of the factors of the climate in our country right now or in the world, right? So those are going to be all things that are going to impact us, and we're all cognitively overloaded right now. And when we have that cognitive overload, it's going to impact our ability to even rest well when we do rest. It's going to impact our decision making. It's going to impact our ability to emotionally regulate, to make decisions, if I didn't already say that. And so I think it's a matter of, beginning to make the spaces when you do have the time for the pausing. And like one of the examples I like to use is when I worked in the schools, there was always this idea that me coming into like the classroom or consulting with teachers or whoever you might be at, that I'm adding extra things for them to have to do when they're already overloaded, right? But I like to let them know, I'm like, I'm not putting anything extra on your plate. I'm just giving you some nuggets to sprinkle in between to make your life easier in the long run. Right. So that could look like, and I could use some examples for kids, but also for adults, because that's where a lot of this started for me. During COVID, when things got shut down, I couldn't work with the kids anymore, and so all I could do was call parents and check in, and hear what was going on with them, and that's where I started getting a lot of my passion for working with the adults that support kids, and then in turn adults, because we all are just kids who grew up. But being able to give them those tools that they can use in the beginning of their day that can help to, start it a little bit more regulated rather than just like starting off going or even thinking about the impacts of, looking at our screens first thing in the morning or as soon like right before we're going to sleep. Like all of those things are going to really heavily impact our cognitive functioning, which in turn is going to wear out on our bodies. Um, I'm going to, I'm rambling. Did I
You're
answer
good.
the question?
Definitely. I appreciate
Okay.
you sharing that because I think this gives a big insight to we are human as well, right? We know that. But we need this reminder of aside from being a clinician, which is all of what you were sharing, what's happening before we step through this door of our office or our clinical virtual space to serve these clients. All of this is going on, right? All of these other titles that we carry. And so it's definitely things that we're facing, whether it be really early on and we're still carrying with us and into our work, turning into burnout, turning into fatigue, stress, and unfortunately, sometimes even illness when we're not addressing it. Because a lot of those times when we're not addressing these things, it can turn into physical things as well. So I appreciate you sharing that as a reminder for us to really pay attention that we are human and all of these things are going on before we walk through that door. And of course,
Absolutely.
even once that door is closed, that's still going on. We try to leave all those things outside, and that's like the biggest thing. It's like leave it outside, right? Our views are our personal values outside, but we're carrying stress, burnout, fatigue. So definitely being really aware of that.
Yeah, and on both sides of those tables, I think there's the part where Man, there was two directions I was going to go. When we talk about leaving things at the door, like, yes, there's some truth to that, but there's only so much you can leave outside that door. Cause like you were saying, we're still human. So we're still going to carry certain, beliefs or, our own stuff. And 90% of this work is working through your own counter transference. So it's a matter of, noticing what's coming up for you in that space when you're working with clients, and what are you doing when you leave the space? Are you going to process with your own therapist? Are you seeking out clinical supervision? Like really noticing what's coming up for you. And at the same time, knowing that when things are coming up for you, it's great to work through that. And so you can show up better for clients. But then there's also going to be a line where it's a matter of, is this harmful to me? And I think especially right now, and some of the things that are happening in the world and the political climate, there's a line. So it's like you have to make sure you're protecting yourself and you're feeling safe in that space as a clinician as well. And then on the other side of that, I think there's a piece, well, this kind of goes hand in hand, but when we try to decolonize these practices and our codes of ethics, right? Like we should be following them absolutely, but also like knowing where these practices came from, right? Like the blank slate therapist, that's out the window. That doesn't exist. Because let's think about it. Like most people highly benefit from working from someone who they can relate to, right? It's a part of the humanness, or even like the things like self-disclosure, or a lot of things that come down to transparency and just showing our humanness in that space. And as far as the burnout piece, it's a matter of like what is the work you're doing, what is your why, and also what work energizes you, right? And I know even for me sometimes like it energizes me to be able to, because representation matters, to be able to work with people who look like me, right? But then also it's the ethical thing to do with not necessarily just work with people that look like me, but if there is an experience that I do not have competence in, it's the ethical thing to make sure I'm referring them to someone who understands, parts of that experience or that population that I might not be so familiar with, right? And of course, going to seek out that clinical consult, continuing ed, but again, knowing the limits and figuring out the nuance, because I think there's nuance with all of this, and we should be challenging it every day.
Yeah, most definitely. We don't want to push through not knowing or understanding our own clients.
Yes. And on the other side of that, when it comes to burnout, sometimes when we're moving so fast, it can be easy to let those things slip by and you don't realize how much it's draining you, because this is territory that might not be in your wheelhouse for one, but two, figuring out what's coming up for you, right? And if we're going too fast, we're not going to be noticing those things. And it takes away from us being able to, actually have the opportunity to sit and pause and realize we need to go seek out that consult, or we need to go process with our own therapist.
Most definitely. And so, how can clinicians distinguish between the differences of compassion fatigue, a lot of what we were talking about, even secondary trauma, a lot of these stories that we're hearing, maybe even moral distress or depression?
I mean, I would say they're all interconnected, right? Because oftentimes, if you're compassion fatigued, especially if you're not in a space where you can actually pause and name it or realize that that's what's happening, it weighs on you. And when the heaviness gets there, heaviness turns into the cloudiness. It can turn into you. Well, one also we back to thinking about somatics and our windows of tolerance. So we think about it as it relates to clients. I also think about it as it relates to us as clinicians. So it's like, what is your window of tolerance for stress? And if that window is hitting its mark, or you haven't done some work to address what's happening within that window, if it's getting pushed, or you're pausing so you can, breathe and make sure you're expanding your window, or staying within your window, because we don't have to beat ourselves up either. um or we don't have to struggle, right? There's going to be some challenges, but we should not be in pain or harmed in these processes. So I think they all end up being interconnected. So when there's that compassion fatigue and you're not getting those breaks, and even if we'll even talk about the systemic parts of not having equitable caseloads, so getting more clients and like actually being able to handle. And I know that like there's the average numbers out there, but also every person is going to be different, and being able to take on something different. You also have the components of in person versus virtual. If you're working with individuals or kids or couples or families, that's all going to be way different. You're interacting with a whole bunch of new nervous systems. That's a whole lot going on, right? Um, Compassion fatigue,
Secondary trauma.
secondary trauma. Yeah. And so the secondary trauma piece comes up to, there are some things that are going to, poke at, you're constantly going to get poked at emotionally. And that's the part that I was speaking about as far as, making sure we're doing that outside work. But there's only so much that can happen before, you're bent out, right? And, I don't want to say necessarily getting disconnect, or I mean, it can cause you to get disconnected from your why, because again, it can be too much, too fast, too soon, in the same way that we talk about how trauma can be with our clients, right? And whenever that starts happening, that can look like us shutting down, us getting flighty and thinking, I don't want to do this job anymore. This isn't for me. I hate what I'm doing. I'm not good enough, right? And I would even say some of those I'm not good enough or I'm not doing enough can especially come in those jobs where there's systems like I'll speak specifically on school social work because you're often the only person in the room or in the school that does what you do. And so people aren't necessarily clear about what you do. So people have these expectations and everyone thinks you have this magic wand. I don't know where they got that idea from. I don't know where they got this idea of a magic wand from. But it puts a lot of pressure on a person and when people put you on a pedestal and have so many things figured out or to be doing, disappointment's going to be inevitable. And then it turns into these messages, whether they're directly or indirectly communicating that you're not doing enough, you're not doing your job. And it makes you feel like you're not good at what you're doing. And it can be defeating. And not to say that those people are right, but, as we turn, like, that's the systemic piece, right? Of, funding, also the ways that, other adults are interacting and doing their own work and making sure they're not bringing it into the space, but also being able to turn within and, working in systems you got to have a whole lot of self confidence and belief in yourself. And I think it really is a space where it will continue to build you up and break you down as far as like you believing in yourself and you knowing that you're doing good work. And a lot of it, I think it all comes down to like, or what makes a good clinician in my eyes is your ability to sit with that discomfort that's coming up and to grow and learn from it. Because it's okay to be uncomfortable. It's also okay for us to know that we both are going to be harm, but we're also going to cause harm. I think that's another thing that's important to know as clinicians when we're thinking about burnout. And sometimes when we're not facing those hard truths, it starts to compile, right?
You were sharing a little bit about the nervous system, and from that point of view from the client, I'd like to kind of see from our nervous system informed perspective, what happens when clinicians remain under chronic emotional occupational stress?
Oh, they're going to check out. There's this thing called limbic countertransference. So, countertransference, that's when, we're being reminded of someone or something else in our lives and it can impact the way we're interacting with our clients. Our body does the same thing. So limbic is really just your nervous system syncing up with the client. So say you got a client like you're going through clients that are in fight or flight to shut down and your body is constantly syncing up with them, especially with people who are real highly emotional and sensitive like I am. So I know that was one thing that I recognized very quickly when I first started getting into brain spotting because that was my first introduction into somatic based modalities. And I remember maybe a month after the first training I went through, there was like a follow up console and I asked about it. And I remember her name is Maria Javaping, awesome brain spotting trainer. But she talked about limbic countertransference and the importance of making sure we can recognize when that's happening, but also going into those spaces with clients with tools. So when we're in the moment, we're able to ground ourselves and stay present. Because we can easily start one thinking of with them, but two start processing ourselves. Yeah. And so based on that, do you want me to kind of go into what some of that could look like as far as
Yeah,
grounding yourself in those moments?
definitely, because we'd like to know anyone who isn't familiar with it, if you can kind of share with us, what does that look like?
Of course. Yeah. And before I even say all this, I'd like to always brief things with, there's 1,000 ways to get to the same place. So this is just my approach and based off of the modalities that I'm trained in and my experiences. So the ways that I have found that to be successful have been so if we're thinking about from an embodiment perspective and given that trauma conscious yoga method derives from IFS and movement, I think about things in parts or sensations. So even thinking about when we're going back to thinking about where things come from, the woman who created trauma conscious yoga method, she's also trained in somatic experiencing. So there's the piece where, if I'm, with the client, I might notice a sensation in my body or something come up for me. So for example, I'll use right now because my head kind of hurts. I'll be like, I'll notice it in the same way, like I'm experiencing headache, and I'll talk to it like a part, like, hey, I see you, I feel you. Right now, I'm holding my presence with the client. I'll be back. And we're almost talking to it like a dear friend. And I think another thing that can be helpful is to find something that you can ground to. So you guys can't see me below the computer, obviously, but like I know that I can feel my right foot on the bottom of this chair. It's very cooling, it's very grounding. I might identify the texture of it. It's a cool temperature. It's like a silver metal. And so it's like I'm already in myself, giving myself that same grounding that I would also speak to clients when we're working through identifying and, aligning with the sensation or emotion in their body so that they're able to and process it. But rather than me aligning with the sensation, I'm aligning with, well, it is a sensation. rather than me aligning with an activation spot, as they might call it, in a lot of somatic modalities, I'm finding my anchor spot or my resource spot. And so I like to align with that resource spot and even just like, speak it like left or left temple. That's, left temple. I hear you. I see you. Right foot that's grounded right here. I hear you. I see you. And just staying grounded to that, I find can be very beneficial. Also, taking a breath. Like no one has ever stopped me from taking a breath, even when a client is talking. Um, that can always be beneficial. And I always encourage people in the same way when I'm practicing. I might invite clients when they take that exhale to sit into that sensation spot. So doing the same thing, and I think a lot of this work, whether you're doing somatic work or talk based alone, is embodying this stuff, right? So how are you practicing and applying yourself? Because that's where the real work is. Like one thing that I can recall someone that I've learned from saying to me was like being embodied and doing that work yourself is what makes you a somatic therapist. It's not necessarily always the tool that you're giving out in that moment or something you're saying or something you're applying right in that moment with the client, but it's you being able to ground and to hold your presence, not your emotions while you're with that client.
Yeah, most definitely. We have to be aware of ourselves and that energy and that space that we're bringing to them. So thank you for sharing that and how we can check in on some pain points or some things that we're feeling and just paying attention to it. Like you said, also taking some moments to breathe, to drink water or anything like that. And I know that's a little bit of a hot topic right now. I don't know if you've seen it being a hot topic of it being a question, is it okay for therapists to drink or eat during session? Would you like to share your
Do you see my eyeball? Like, do you see my eyeballs? My water. And my clients already know, like if it's like I'm not gonna sit here and have like my whole like seafood boil or anything like that. But if I need a little snacky snack to make sure I can stay awake and present, like I of course I check in with them first, like, hey, is it cool with you if I have a snack while we chat? And I have not had any pushback. I think a lot of that also like ends up not being an issue when you have built strong therapeutic relationships with your clients. They want you to be well. And I think that's another thing I do want to talk about is whenever, like, as much as you're attuned with your clients, they're just as attuned with you. And I'd like to share a little story if y'all want to hear about a time when it really hit me in the face. I was like, man, like my clients know when something's not right with me. So I had some health issues myself earlier this year when I was going through some of my own burnout, hence why I'm passionate about this topic. It's something I've experienced. I embody it or experience it, but I also embody using these tools, right? But I had, some lower blood pressure and it was starting to impact my energy levels. And I was in session with a client and she just so happened to be a doctor. But I'm sitting there like not realizing I wasn't like appearing well. And she kind of hinted at something. And I think at the end of the conversation, something came up and she immediately went into a little bit of doctor mode. But it was necessary. Like I was about to fall there. And thank goodness she was the one at that moment. And it was something that I had to sit with and I had to sit with for myself. Like, did I share too much? Did I like allow her to go into this caregiving role? And once I sat with it, I was like, you know what? I was having a human moment. It's not like I'm always just putting caregiver responsibilities on this person. And I was actively not well, and she noticed something. And I'm still gonna have a conversation about it because there's time remaining things. So our next session, I just checked in with her, let her know that I appreciated the support that she provided because even before the session, she checked on me again, like sent me a message and was like, "Hey, just checking, is everything okay?" And I just let her know, hey, I appreciate everything you helped me with. I got it. Like, I got what I needed. Not thank you. Right. So I kept it as brief as I could. But of course, even before me bringing up, she's asking a session too. And so I name it. I let her know that, I appreciated that time. And, I want to make sure moving forward, I'm not putting her in a caregiving role. And she very quickly stopped me and she said, I made a choice in that moment. And she was like, and as much as you care about me, I care about you too. And she was like, and she was like, I know around this time. And she was like, she was like, one, your eyes were kind of doing this. And she pointed out the things that she would know as a medical professional. She's like, and also, I know at this time, she's like, you didn't have your snack. I didn't see you with water. Like she was noticing things that I usually have there that she wasn't used to like me saying, like saying with me. And so it was in that moment where it was like, I also got to breathe and allow myself to be human. And it's like, they notice when something's not right. That also doesn't mean that you're a bad therapist. You had a human moment, you addressed it, they also like spoke on the fact that they don't feel that you're doing that. And I think that's the powerful part right there. It's like, this isn't a dynamic. This was a moment of need. And that person just so happened to have the knowledge and the skill set to step in and make sure I was okay. And I think in a lot of ways, it's both strengthened the therapeutic relationship because once she got to see my humanness, but also she had an opportunity, like we're building a relationship. Like not just like again, not the caregiver in that dynamic. That she's not the caregiver, but that's a part of being in a relationship with people. Stuff happens sometimes, and it's going to happen with us in these therapeutic settings as well.
Yeah. And it's difficult when these things happen, but I think it's an important moment to show like give ourselves some grace in when that happens. And it's an opportunity for us to show, I've showed you all of these skills, but I apply them as well, right?
Mm-hmm.
And so that was the opportunity to do so. So thank you for sharing that story with us. Definitely, our clients can definitely connect and notice how we're doing, especially since they see us pretty often, depending on what those sessions look like, whether it be weekly based or some of these more intensive services that might be given as well. So thank you for
Yeah,
that. I'm glad that you had that out
absolutely.
there.
Absolutely. And I think to tag on to that, I think I wanted to address this earlier was like, I think in grad school, there's not a whole lot of emphasis on transparency as it relates to like us as clinicians in this space and how we're coping with things. Like I can recall for me, between grad school and some other life experiences prior, I always valued transparency, and I just wanted people to let me know what was going on. And I remember I had a professor I had a really close relationship with who was very transparent with me with a lot of things, but when it came to me asking her about clinician burnout and how are they coping and if substance abuse and other health issues were a factor, she clammed up. And that alone like was my signal that there was some truth to whatever I was speaking on, but I just wanted someone to name it. And that was my purpose in even sharing the story that I just shared with y'all, because sometimes when we're not being honest with people, it takes away from them being able to feel like they can trust us. Right. So even in me being honest with my client, like, yeah, actually, I'm not okay right now, you know? And not that I had to say it, she could literally see it. But, showing your humanness creates that opportunity for people to build a relationship and for a lot of trust to be there, right? Because at the same time, not to say that like we want to go, like I mean we're going to go through things in life, it's inevitable, right? But what kind of therapist would you be if you hadn't experienced hard things?
Yeah, most definitely. And being able to identify them and work through it. So for some of us who haven't entered those therapy rooms or those services to apply them themselves. Hopefully, this kind of encourages you all to do so as well. We don't have to wait for that moment to be like, oh, we're going through this big thing, whether it be change, because I think that's like the best time to do it, or a difficult thing. But we could just be going through the motions of something and it helps us so much more. So thank you for
Absolutely. And then
sharing.
this isn't directly, well, it's somewhat directly linked to it, but when we're talking about eating and drinking in session, the one thing that I would be mindful of is if you work with clients with ED, so making sure that it's not going to be harmful in that environment for you to be eating. And so, or even like I know some people, it's not my specialty, but I have had a client who she came in for something else and she ended up becoming active in her eating disorder. And we ended up staying together because we figured out the root of what was going on was not the ED, there was something else happening. So we stayed together, but even being aware of that. So that wasn't necessarily a client I would eat with initially. Or like the times when I did or when I was going to, I always asked her before it even got to the point, but just kind of asking her what her thoughts and feelings were about eating because our session happened to be right around dinner time when I would get really hungry and I was going back to back. And so I didn't ask when I had the snack in front of me, but hey, I know, or from what I know about you, naming the elephant in the room, we're working through this thing together. I'm curious, like, what are your thoughts and feelings about people eating around you? And she's like, I don't care, which, we can also take those things with a grain of salt, but also based on the way that she had expressed her thoughts and feelings about people eating around her period, it wasn't something that fazed her. So I knew that wasn't coming from a people pleasing part of her. I knew that genuinely wasn't something that bothered her. So I would also just be aware with it if you're working with someone with ED, that can also be a really powerful tool depending on your skill set and if that's a part of the treatment. But just something else I wanted to throw out there.
Yeah, definitely being really aware of all of your client's background and their diagnosis. Just like you said, you all were focusing on something else, but sometimes that can be part of it, or not necessarily part of, but something that they're experiencing. So always assessing and asking those really important questions when we're needing to, because this is a bit of a hot topic right now. And I want to make sure that anyone who's tuning in and listening takes this information from our presenters and what these perspectives that we have, and really encouraging you all on this other side too. So,
Absolutely.
um,
And I think it's also important to be mindful of, what's a hot topic on the internet versus what's really happening in these spaces. Because I'll tell you this much, I've never had a client have an issue with me eating. But clients are a lot more understanding and give grace than you realize. And honestly, if you have people that are throwing a fit about you drinking some water, that speaks to a way bigger issue they probably need to explore.
Yes, most definitely. And doing some work around that as well. So, but
Hmm.
yes, clients are definitely much more understanding than we think. So just asking the questions, and making the space comfortable for not only the client, but for you, because if we're uncomfortable or we're needing something, we're definitely wanting to address that need as well, so that we're showing up completely, and fully for that session. So, thank you.
Absolutely.
Now I know you have some experience within anxiety, ADHD, and then in a little bit we'll get into some of the serving BIPOC clients as well. But how can identity, race, gender, anxiety, um, and masking really shape a clinician's vulnerability in burnout
Ooh, the clinician themselves or the clients they're working with?
for the clinicians?
Ooh, whew, that's loaded. So basically the question is how can our multiple identities impact our work and burnout? Yeah.
Yeah.
Yeah. So I think, or sorry, I had to paraphrase it for myself so I can think of an answer.
You're good.
I think there's the place first where it's like identifying all the identities that you hold, right? And then also understanding, what are some of the or what is the history of some of the challenges that those identities have had, whether it's, past systemically in the world today, right? And noticing that, what was I gonna say? I think having an understanding of each of your identities and how they already are influenced by the world, and how both how you move through the world, but then also how you are received in the world and some of the stressors that come with that.
Yes, and that could be anything, because some of us could also have some diagnosis of ADHD, or even, chronic illnesses, anything like that. So how do we deal with that as clinicians?
Ooh. See, I feel like I could give you a list for like all of the things you just said. That's how I don't even know where to start. But it's like if we're talking about, I'll talk about just different mental health disorders. ADHD, for example, and I'll even throw in anxiety because oftentimes those can get intermeshed and can look like one or the other. But thinking about how the ways that that impacts your cognitive thinking skills, right? So that's also going to impact your ability to pause because with ADHD, I can speak for it too. We be going, whether it's physically or in our brains, right? So that ability to be able to pause can take away from your decision making, your noticing, right? But some of the other ways to get to, working with that can be, and again, I know that there's these systemic parts that go to it, right? But mindfulness really is a big help when you're learning to slow down and to notice and, training the muscle in your brain of like, there's no good or bad. These are labels we've created. They just are. And noticing what's happening to you or noticing what's happening as experiences rather than like consuming or saying I'm anxious, but being able to move it to I'm experiencing anxiety, noticing what that's like. Just giving an example of some of the ways that we can help ourselves to become more mindful and in turn can help with our decision making, our emotional dysregulation, our critical thinking skills, and then just being reminded that all those things are connected. Because when they're not, then that's how we get into that burnout cycle. Because then you're too tired to make a decision. You end up being irritated. You're cloudy, like clouded thinking. That's going to, impact your decision making skills and being able to regulate all that kind of stuff.
It's okay.
I
You
think
also mentioned wanting to share about anxiety, because that goes a little bit hand in hand sometimes with ADHD. Did you mention?
Okay. Yeah, I think the biggest thing is the constant going, like the being disembodied. It ends up being very common in folks with, anxiety, ADHD, and oftentimes, anxiety's cousin depression ends up being on the other side of that when you've been going for so long. Like if we're talking like, thinking about the states of the nervous system or polyvagal theory, you get to that fight or flight. And it's like I think about like driving a car and like full throttle for so long, it's like it's going to run out of gas and crash, right? So it's eventually going to hit that shutdown or that dorsal. And it can physically look like your shoulders caving down. So you might even notice that with clients if you're working with them. So that can be a sign of, a dorsal shutdown response to something. But constantly going through these different states, right? And the goal is not to not go through the states. That's going to happen. We're human. And I think when we think about the nervous system these days, it's all about nervous system regulation. And it's like, I think there's also the piece where, yeah, we want to learn how to regulate, but we don't also want to keep turning within or regulating out of in the name of avoidance. I think it's more so about building your nervous system resilience. So, what is your ability to be able to ebb and flow through these different states and more smoothly move back to that ventral or connected state?
Most definitely. And we talked a little bit about this earlier as far as um, how we can experience things differently depending on how we've grown up and what we were like exposed to. So, what are some maybe invisible or emotional things that can affect BIPOC clinicians? What is it that we're expected to carry as BIPOC clinicians?
Mhm. Very subjective because again we've all had different upbringings, right? But if we're thinking from like a generational sense, it's like you're already carrying things that you don't even realize aren't yours or that you are carrying. And just because we don't know what it is doesn't mean that it is, right? So we are commonly carrying, emotions and trauma and experiences from our ancestors and those before us that we have no idea about. And so it's like we could be carrying that. And then on top of coming into these spaces with our own everyday life stuff and, what's coming up for clients can be a lot. And then depending on what your upbringing was. So, depending on, if you grew up around community violence, that can oftentimes cause some hypervigilance. Or if, and I mean, there's the piece where there's no bad parts. If we're speaking from that IFS or parts work perspective, where like not good, not bad, just is. And so it's like in some ways, like that can serve you. Like it can serve you in the sense of like you are vigilant and you're observant. But at the same time, it's like what have you lost because of this? What have you gained or how has this served you in the past? What have you lost because of this? How is it working for you now? And how do you want to move forward? And now I'm kind of speaking on just like some framework perspective, but also how we can work through these things as clinicians. Because I'm personally a big fan of IFS and parts work. I think it's great for turning inward and sitting with those things, especially when it's used in a culturally competent way. Trying to think what else. Did I answer your question? I think I'm giving examples, but there's just so much underneath that umbrella. But that's the first thing that comes to mind for me.
Yeah.
Um,
What are some other frameworks that really stand out to you that you'd like to recommend to our audience?
as it relates to clinician burnout.
Yes.
Ooh, so I mean, I'm biased. I'm going to be like somatic umbrella, and I love the ones I'm trained in. But I think I would say anything that's going to be embodied. I love brain spotting because it's gentle and it's more intuitive, and it really is decolonizing theory. This is not a downplay on EMDR. It has a place. It works wonderfully for some people, but I know even like statistically, like there's some people who might experience some PTS where they are way too out of their window of tolerance for EMDR and they shut down. And oftentimes I've heard that they get recommended to do brain spotting because it's a little bit more gentle. You don't necessarily have to relive an experience, and there's some flexibility in the way that you use it. Um, and so I really like brain spotting. You can also do what's called self spotting. And we're honestly all always doing that subconsciously. So, you know how, like, when you're just kind of staring into space and your brain just starts going places, you're self spotting. You just happen to be, like, when we call it brain spotting, it's really doing it to process a certain experience rather than just like doing it mindlessly, right? But we're already self spotting. But I like anything that can help you to get into your body. I also like to pair that with the beliefs and values work because when we are aligned or when we're certain about what our beliefs and our values are, doing the work of, where did these beliefs and values come from? Again, how did they serve us then at that time? What did we lose how is it working for us now? And what do we need to move forward based on where we're at in our lives right now? Can be huge with decreasing, symptoms of anxiety, especially because that's less decision making. Because it's like, what, I know that this is important to me at this time of my life, and that doesn't align with that. Or even if something comes along, like on the opposite end of the spectrum, like I've had opportunities come up, and I'll give my example. I think examples are so helpful when it comes to this stuff, and it goes back to transparency. But I know for myself, a big theme in my life has been community, both professionally and personally. And I've got some goals and things that I want to do in the field, this year. But there's been some opportunities that have come my way that were not necessarily what I had in mind. But I was like, you know what? That aligns with my beliefs and values right now. So yeah, why not? Absolutely. It was an easy yes. It made sense because I was aligned with who I am and where I am at this time. I think oftentimes that can cloud some of our judgment or make things more confusing or anxiety ridden. And then just as important as it is to develop those things, to also come back and revisit because we're always changing and evolving. So are our beliefs and values. And also noticing when you're making these decisions, how's your body responding to it? Or even when you're, writing out or reflecting on these different beliefs and values. How is your body responding to you naming this as a belief or a value? Is this landing softly? Is your body having a hard time receiving that? Is it making you feel icky? Like, are you literally clenching when you say it? It's like, that might be a sign that your body's like, probably not this. This probably ain't it. Right?
Yeah, most definitely. Thank you for sharing that because it is important for us to be in tune with those things and be able to name them, be like, oh, yes, I'm brain spotting right now, and taking that moment to pause and actually brain spot, as you mentioned, and also being very well aware of our beliefs and values. If we need to take the time after today's session to write that down or review them, as Mariah shared, they're always changing and evolving with us. So I hope that we can take that away from today, along with all of the other information that we are sharing here today.
Yeah, and I wanted to speak a little bit on trauma conscious yoga method,
Yeah.
and I say it because these are the things I've blend together that I find to be beneficial for both my clients and myself outside a session. But trauma conscious yoga method I think is wonderful too, whether you're interested in the yoga part or not. I think especially if you're a yogi or ever interested in yoga or adding movement, we're not going full like workout flows with clients, right? It's really a matter of just finding some different movement that the body might be asking for in that moment, depending on sensation. So I oftentimes follow the sensation, but also knowing there's a counter for it. So say someone is, experiencing, heaviness in their chest. We might do what's called a cactus pose. So, bringing the elbows down to your rib cage, knocking your head back and making that space open. If that's taking them out their window, just for example, I've had a client get there and be like, I'm having a flashback. And so I might say, okay, maybe notice what it's like to hug back in, notice what that's like. But even then, making sure, especially with your clients who have a lot of, CP, well, I'm not gonna always say everything is a disorder, but when your clients have a lot of distressful experiences or might have some PTS, it's really important to make sure that those resource spots are identified before you get into any of those trying to touch on the activation spots. Because you want to make sure they know they have a space to come back to if it ever becomes too much. But also, a lot of the work is bouncing back and forth between the two. So you're again, that's actively widening that window for their brain and their body to be able to tolerate that distress. Because we can't change what happened, but we can, turn within and we can process it in our bodies. And that's what I love about all of these. So it's not about taking it away or undoing what happened, but it's a matter of widening our window of tolerance when those thoughts or emotions or something that, reminds us of that comes up. And so we're able to be with it, with the discomfort, and it's not making us run or harm ourselves or someone else. But yeah, and on the note of trauma conscious yoga method, they've got some trainings coming up this year. So if anyone's interested in getting certified, highly, highly recommend them. No one is telling me to say this stuff. It's just a modality that I strongly believe in, and I think can be really beneficial for clinicians. And if you've ever been interested in IFS or parts work, it's also another really accessible way to get a lot of that information because the training really is a lot of the history of yoga and IFS and decolonizing the work of both. So I just want to add that little tidbit if that's something that anyone has ever been interested in.
Yeah, thank you for sharing that. Those were definitely some really great insights, especially as you shared like the cactus pose and how it's affected some of the clients and that experience that you've had and how to bring it back as well. So thank you for sharing that. A lot of these different yoga poses can be so beneficial for a client. So if we haven't already, just being aware of what is beneficial for some of our clients, because there's lots of different frameworks to utilize as well. So.
Absolutely.
I do want to see, because ethics is such a huge part, of our practice, and we always want to be aware of this. So I wanted to ask you, at what point does burnout become an ethical or clinical concern?
Mm. I would say when it's negatively impacting the work you're doing with your clients. Yeah. So if you're not doing that turning within, again, like we're all going to be harmed and cause harm. That's inevitable. But if it's a constant thing and you're not taking that moment to pause and to do the work outside of it, yeah, unethical. And I don't say that to like shame anyone, but that's more of us making sure we're taking accountability and doing our due diligence from both the ethical and a moral standpoint, right? Because as I mentioned earlier, 90% of this work is working through your countertransference. So it's important to go see your own therapist to get clinical consultation to be able to sustain this job. Because on average, a lot of people tend to burn out from this field between like years 5 and 7. Yeah. And so, I mean, even before you get to that 5 and 7, start making sure you're doing the work so you're not getting to the point where you're literally knocking your head on a wall, like ready to call it quits. Yeah. And even if you do get there, still finding your supports. I think, especially if you're going to go out into private practice and you're doing the solo thing, it's fun. It's nice to be on your own schedule, depending on the type of life that you're, or, what your lifestyle is or what you're building. But it can get really lonely because you don't have coworkers. You're just, holding space for clients. And personally, for me, like, I'm solo. I live alone too. And it's like that really weird. That can also wear in a person. So making sure you're also getting socialization outside of client work, figuring out what it looks like for you to energetically disconnect in between sessions. And also once you take that work hat off, like one of my favorite ones that someone has taught me, I've been missing a yoga teacher training, and I think it comes from like Reiki work, but the it's the example of like removing the umbilical cord. So after each client, like pretending like taking your hand by your stomach and twisting the cord as if that's like what's connecting you and that client, and not to like avoid them, but to disconnect that energy from you so you're not carrying it. And then when you're done twisting it, chopping it, chopping it, chopping it, and then tossing it, and it's like you both get that like visual standpoint, but you're also getting that somatic experience of removing or, disconnecting yourself from what's not yours. So that's just one of many ways that I like to disconnect. I make it a point to I physically get out of my seat and try to use the bathroom in between session and just try to use it whether I go or not and wash my hands. It's just a way of me kind of like moving on to the next thing. So I'm not carrying, the last client stuff into a thing or not, or whatever it might be, or into the rest of my day or what I'm doing.
Yeah, thank you for sharing that. That's definitely some insightful things. I hadn't heard of the umbilical cord one. And I love the idea of washing your hands because that was really big for me. Like at the end of the workday to like take a shower and visually like see like, okay, it's gonna be like washing away or getting rid of this, but of course we can't take a shower in between all the sessions. So definitely like
Right.
putting some of these things into practice of like washing my hands or whatever it is that we can do. Even I think scents like make a huge difference. So if that's something that we are comfortable with, like sprays or candles, anything like that, um, can be something to reset us. So thank you for sharing that. Uh,
Absolutely. And then also, I mean, I know, excuse me, this looks different for everybody, but move your body. Like I know we all have different, limits and abilities to doing it, but even as much as a good morning stretch or, I know trauma conscious yoga, because everyone that does that training is not necessarily trained in yoga, nor do you need to be. But some of the basic movements we teach when we're like helping clients to process, which, hold on, excuse me, first I'll say the thing that I love about all of the somatic trainings I've gone through is that you have to go through the processing yourself. So you're truly having to embody it, and you end up doing a lot of your own deep processing, but you know what it feels like in your body to do these things that you're asking clients to do or that you're inviting clients to do. But some of like the basic movement that can be accessible to all is reaching one arm over, going the other direction, taking a side body twist, placing one hand on the opposite knee, twisting. Yeah. And so, I mean, of course, not all of these, bringing your torso into your legs, that cactus, right? So finding movements, all of those movements actually help with bilateral stimulation. So your ability to process, right? And so even when we're with clients or outside of the room, finding time and space for you to move your body, no matter how little or how much it is.
yeah, thank you for sharing that. And so from an organizational point of view, sometimes they provide lots of mindfulness sessions or wellness challenges. Now, from this, what is it that they might be getting wrong and might need to switch up, especially for those maybe directors who are tuning in or supervisors who are tuning in, or of course, other employees of the organization who would like to advocate for this?
Great question. So I would say this all goes back to the systemic part, and I know clinicians will be with me on this, and I understand some things are easier said than done, but a lot of this goes back to the systems of things. Like, I know that there can be lack of funding for things. I know, like all of these things, right? But where there is funding, where is money being allocated to? Is there opportunities to hire other clinicians? Are we, depending on if you're like in a community, mental health agency, which I don't have direct experience in those spaces or not, but depending on where you are, because I know even in the schools, like I played around with doing groups. Like, how can you maximize the time you're using? So, like, I would have kids, just for example, well, this is more so a clinician example, way that you can tweak it, but I'm going to also speak to the systemic piece. But like, I'd have a lot of kids who had social work minutes, like 15 minutes weekly. So instead of that 15 weekly, I get a group and do 30 minutes bi-weekly. Like, how can I maximize the time without trying to meet with every single kid? Like, it does not work. It's impossible. I've worked for two of the largest school systems in the country. There's no way that that would have worked, especially in special education. So it's like maximizing the time, also, creating or getting some templates for your paperwork. Like writing IEPs is no joke. So, what are, the templates you have for your evaluations, your scales, the way that you're going to write this out? Like, do you have some common language? And then there's also the piece when I was working in schools, AI was not a thing yet. But even now, like, without putting in confidential information into these AI systems, can these systems support you with writing your notes? So it's helping you to save some brain space, right? Um, Taking a break, taking your lunch break. Yeah, I'm talking to you, whoever's listening to this, take your lunch break. Also, that often means leaving that building. Like that was a hard boundary for me in a lot of the school settings I worked for. I needed to physically leave the building because y'all already know someone is going to find a way to knock on that door, still try to get your attention when you're trying to eat your salad. So leaving the building for a break, getting outside, even if the outside moment is 5 minutes, but just finding those little moments in between. And then also, especially, I mean, I'll say kids or adults, because as adults, we often forget to give ourselves permission to play, but having your clients join in on these things too, like, hey, let's just take a good morning stretch real quick, or let's breathe together real quick. So that co-regulation, powerful. But as far as the things that are out of clinician control, and then also, scheduling, time management, we can only do so much of that. That would be like for me to like just pin it on that when we try would almost be me sounding like I'm trying to CBT someone out of reality, which we know that that is not cool and that could actually turn into gaslighting and be more harmful. But on the other side of that, when we're thinking about the systemic pieces, we're thinking about where is funding going? What is clinician education and, care look like outside of just bringing in like, this wellness person or whatever? Like what systems are they putting in place to make the workplace a place that clinicians want to be at? How are they making sure that clinicians feel appreciated even? Right. And I know like there's a lot of, I've seen a lot of disconnects with that between both the schools or even like I haven't worked in like hospitals, but I know even there, like, social workers are treated differently than how some of the other employees in hospitals are. So how are we making sure that we're being equitable in the way that staff are being treated and shown appreciation for and taken care of? Um, I think what else? I think also with leadership and the ways that they're interacting with their employees. So, again, no one is perfect, but it goes back to we're all going to experience harm, we're all going to cause harm. So, as a leader, how are you reevaluating the ways that you're showing up in this space? How are you evaluating, what your barriers are? How have you worked through those barriers in the past? How have those ways helped you? What have you lost because of them and how are they working for you now? What do you need to do to move forward? Right. So I think a lot of things do end up like a lot of systemic issues go back to leadership, but also systems. I get it. Um, but that's what I would say are some places to start. And then, of course, like, I mean, this isn't going to be the answer that everyone wants to hear, but also knowing your limits and when it's time to go. Because if these leaders or these systems are not trying to meet you halfway, like, then you can't kill yourself being at these jobs. They'll replace you tomorrow.
Most definitely. And I think as the mental health professional background or social work background that many of you all have as you're joining in, there's so many career paths to take, whether it be hospital or school or, just all kinds of backgrounds. And now that the virtual space has opened up and we're
Mhm.
hoping the compact also finishes up very, very soon. We're super close, I think. Definitely opening up more opportunities and doors for you to just experience something different if that's what you're needing. So thank you for sharing that.
Absolutely. Yeah. And I think in addition to what you just said, to piggyback onto it, I think also knowing yourself and like what type of work, like what work rhythms work for you. So for me, ADHD, I am not a one track mind. I like to have multiple things I'm doing. And the thing I noticed when I got into private practice is I was burning because I'm like, I'm sitting here the whole time and I'm like, I need to move. I need to do something different, right? Whereas schools, like, I got to do services, I got to consult, I got to move around, I got to go to different schools. So I was never just sitting all day, right? And so because I know myself, I have to, and even before I was a social worker, I always had multiple jobs. So it's like, does that model work for you? So like for me right now, I share with you guys, I do a few different things. So I do hold the space and I'm still doing therapy. And I love therapy so much that I have to, like, I have to switch it up if I want to sustain. So finding out what else you're passionate about. I love clinician education. I love yoga and movement and being able to, combine all those things, but also have them in separate places. So like I teach yoga at a local studio as well. And I do workshops here and there and, just finding your rhythm and what works for you. And I might even, if someone wants someone to come in and speak or yap about mental health or somatics, like those things, it's like those are the things that come natural and resonate and they're a part of my values. I love to educate, I love to hold space, I love to create, right? So even like I've created, I just published my first digital resource. So I'll have a 7-day somatic reset toolkit. It's on my website. Hopefully my website is included at the end, but if not, it's just www. Did I say too many W's? It's relevantwellness.com. Um, but it's a 7-day toolkit that has 7 different prompts for each day of the week. And then there's also a guided meditation that's included in there. So there's a QR code inside of the PDF file that you can scan, listen to. I encourage you to listen to it before each day that you sit with the things and or sit with the questions. And these questions are all things that you can revisit beyond the 7 days. And so that was also me figuring out what I love. And I love to create. And I'm also really passionate about making mental health care and wellness accessible. And so I don't know how this is like kind of going off. This is wow, this goes into the burnout category, but as a clinician right now, there's a lot changing the insurance landscape in private practice. So I was already trying to make some of these changes and then the insurance thing happened. So I had to take a step back from my new changes to do some, to maintain some fires. What's the word? Not chaos control. There's another word. Y'all know what I mean, though. But I had to take a step back so I could put some energy into that. And I remember when I was not so happy with one of these insurance companies, and y'all can decide if you want to edit that out or not. But when I was not very happy with some of the practices that they were putting in place to cut our wages, but also to raise clinician or to raise premiums for patients, I was like, this is changing things. We're already seeing that a lot more therapists are willing to go private pay or cut out some of these insurance companies, which is valid because we got to eat and take care of ourselves too, right? And it can't be, we can't abandon ourselves at the expense of, these systems. So in that moment, I composted my anger and I created this resource. And I think that's another beautiful thing about some of these uncomfortable emotions and these uncomfortable circumstances that come out. Like, it's like, yes, it sucks and I can't change that it sucks, but let me sit with the anger like that it is bringing up in me and put that fire and compost it somewhere else that's going to be productive for both myself and others and what it is that I stand for. And so that's how I got to creating that resource. But you can find it on my website. It's also on an Etsy page and I have it on sale for the first several weeks of the sale. So if that's something you're interested in, I would love it if you checked it out.
Awesome. Thank you for sharing that with us. And of course, all of this really great information. So, as a takeaway, definitely checking this information out or the website for more information. I want to go ahead and share with you all what our resources are, and where we got our information from, as far as what we were talking about today. And then, of course, really great information here that we can visit her website. I really appreciate your time here today, Mariah, for all of us who are joining in for this credit and to learn more about burnout and really taking it a step further. Hopefully you all learned some really great things because I know, the cactus pose and the umbilical cord and lots of other things. I hope you all can take away from this. But thank you so much.
Absolutely. I think one other thing I thought about as you were talking when I think about burnout prevention is in the beginning of at least my time in the field, I'm a rule follower. So I'm always trying to figure out how I can do something right. And I know a lot of us are in here. I went to grad school with y'all. But I was gonna say, I realized I spent so much time and energy and had so much anxiety trying to make sure I was doing it right that I wasn't allowing my personality to be there. So I also encourage people to be yourself in this work. And I know it takes time because you're learning a skill, especially early on in your career, but there's nothing that's the most impactful thing that you can bring to a therapeutic relationship in the or not, hold on, that's not what I was going to say. you know, there is no modality that's more powerful than a healthy and secure therapeutic relationship. Like I can refer people to this person for this modality all day long, but if that person doesn't know how to build a relationship, the modality means nothing, right? Because clients got to trust you, but that comes from you being able to be yourself. And it also, it takes away from you feeling like you have on this mask or this blank slate that they once taught us to do that is, or to have, which is not a thing anymore. Of course, you want to make sure you're leaving biases out the room within reason, as long as they're not harming people. But I think that's when we got to make sure we're bringing them back in. Um, but yeah, just finding the space to be yourself in these things. Yeah, that's what I got to say. I could keep rambling about this all day and what my journey has looked like doing that, but it feels a lot more natural and it's very freeing to figure out how to be yourself in this work. And people feel it.
Yeah, most definitely. And as that key takeaway too that you mentioned, clients understand us a lot more, are so understanding of us as we build that therapeutic rapport. So always keep that in mind. Take care of yourself as you show up for your clients. And of course, anyone else that's in your life from all other titles and things that you carry. So thank you so much.
Absolutely. Thank you so much, Bonnie. It was great talking to you today.
I hope you enjoyed this continuing education course from Agents of Change. Want to earn your CE credits for this course? Visit agentsofchangetraining.com or click the link in the description to purchase the course and earn your CE certificate. If you're looking for more CEs, check out our unlimited plan. You get unlimited access to more than 200 ASWB and NBCC approved continuing education courses and more than 20 live events each year for one low annual fee. We're always adding new and exciting courses. Check it out at agentsofchangetraining.com.